you that based on your specialty, how do you think that Mount Elizabeth Novena Hospital will have contribution to the better treatment facilities to the patients?
Mount Elizabeth Novena Hospital is a very exciting prospect for all of us.
Okay.
Myself, I am a cardiologist. I'm an interventional cardiologist. I'll go into what that is in a short while. But this hospital allows me to expand on what my training has allowed me to do with the high standard of new technology, nursing standards, and overall wow experience that we can give to our patients. This hospital has state-of-the-art facilities from diagnostic to treatment modalities and intervention. I am an interventional cardiologist by training. I see general cardiology patients, but we also treat what needs to be treated, meaning I specialize in cardiac intervention, where we intervene and open up things like when we pass a catheter in. You've heard of angiograms, of course.
Yes, we did.
Yes, and then angioplasty, where we open up with balloons and stents. What we specialize in, or at least I specialize in primarily, is doing them from the radial approach or from the arm, because you'd have heard of the conventional femoral approach, where we go in and treat patients. I also have had training overseas and brought it in here to this hospital, where we use new technology to treat heart valves and kidney-related high blood pressure, which we can do. And I'll go into that in a short while. But basically, what we do is we use the expertise of everybody within this new center that we have formed called the Parkway Heart and Vascular Center, where you have a multidisciplinary approach where people with different subspecialties and different skill sets come together and give the patient the combined experience and expertise that we can give.
Okay, so the modern technology that you are just mentioning, would you please explain a little bit so that it is more understandable to our viewers?
Sure. What I had explained before was angiograms, angioplasties using the radial approach. In the early days, we tended to do most of them from the groin approach, passing a catheter up, and we've moved on with the angioplasty and stenting to here. That's because we've had smaller, or we've developed smaller catheters that can do it from the arm. Now, for patients with heart valve disease, what we have always done is surgical therapy, where it's open heart surgery for valve problems. 4% of patients above the age of 75 tend to have a condition called aortic valve stenosis, where the aortic valve, the main valve that channels blood out into the body, is tight and a little bit closed. This tends to happen because of calcification, age-related problems, and that's why we have said that people above the age of 75 tend to get this. These people have a higher risk for surgery, and it has been found in multiple studies that 33% of the patients who have this disease do not get the treatment that they need because they're deemed too ill or their risk is too high for the surgery. What we have is a new technology. This is what I went to Germany to learn how to do, a new technology where we can pass a catheter from the groin, the same way the angiograms were done in the past, pass this catheter up, open up the so-called stenosed or narrowed valve, and then implant a stent-like device, which is actually another valve inside it, thereby avoiding the need for open heart surgery, thereby making it more comfortable for the patient, making recovery faster for the patient, and also reducing the overall risk. This is a newer technique that does not exist in most places in Asia, if you will, and so we are able to offer this in our hospital because we have the hybrid lab that you've all heard about before this. The hybrid lab is a lab that allows surgeons and cardiologists to work in unison in a sterile environment with all the equipment that both specialties require. The hybrid lab will allow us to implant valves like this safely for the patient using this multidisciplinary approach that I mentioned before. And what's even more exciting is the fact that we can also do hybrid procedures for opening up the arteries. In the past, when someone had blockages, it was ballooning and stenting, or bypass if it was very bad. Studies have shown that the main mortality benefit that is given to a patient is from the artery that's taken from the inside to do the bypass. So with our colleagues, we are able to provide a minimally invasive approach for the bypass where there's only a cut from this side, at the side of the chest, as opposed to a big cut down the center, mobilizing that artery and coming down, and then stenting the other arteries, because vein grafts taken out from here tend not to give as good results as the artery grafts from inside. So we're able to combine these two modalities and therefore do what we call a hybrid procedure, which is basically the whole idea behind a hybrid lab. Hybrid meaning a combination of several different types, 2 or 3 or more different types of treatment modalities or things that we can offer the patient.
Do you have anything to say to our audience of Bangladesh?
Yes, we all have a similar sort of origin. We're all from Asia, and it has been described that especially people from Bangladesh, India, Pakistan, etc., the Indian subcontinent is something that has been described as a geographical area. It is very, very well known that heart disease is very prevalent in this part of the world. In fact, it's been seen that people of this origin have 3 times as high a risk of having heart disease as opposed to other Asian populations. We've done these studies in Singapore where it's shown that people of this origin have a 3 times higher risk of getting a heart attack, getting a stroke, or suffering from heart disease and requiring treatment. Therefore, people from this area, and people in Bangladesh especially, are in a high-risk group. I would recommend that people from Bangladesh actually have good periodic checks. You may ask what age you should start this from. I would tell you that if you're above 35 years of age, whether you're a man or a woman from this part of the world, you should have a proper health screen with a cardiac emphasis. What is really exciting nowadays is that we have the ability to diagnose disease at an early stage before it becomes a major issue, before it becomes a requirement for angioplasty, stenting, bypass, or valve therapies. And we can prevent the progression of this disease with new technology in diagnosis, new technology in treatment. That is the most important message I'd like to send out to everybody. A general health screen is great, but a general health screen with a cardiac or a heart emphasis is the most important thing. And if you need to do something, and if you need to get it checked, you need to go to a place that has the expertise to deal with it. We hope that in our center here, the Heart and Vascular Center that we have at Mount Elizabeth Novena Hospital, we can provide that service. And we can provide a service that will make a difference to your lives, to your quality of life, and your longevity.